So Renuva is intended for the use of replacement of volume loss, fat volume loss. So it needs to be placed in places where fat already exists. Now, in skilled hands, it can be used for all kinds of things, whether it's improving the volume in the face or even changing the facial contours to some degree. However, that's something you need to discuss with your practitioner. HAs will create a sort of blob of volume. It's not tissue, it's a filler, it's a gel. And in some cases, an HA is a better product for a specific use. It can cause sort of increased projection in a very specific place. In the aspect of using it for the angle of your jaw, sometimes HAs can be better. However, I'm not saying Renuva isn't the right product. It's just something you need to discuss with your doctor.